Welcome to the best hour of their day podcast with your hosts, Jason Fernandez.
And me, Jason Ackerman. With more than 20 years in the business,
as both coaches and affiliate owners,
our passion is to help create world-class affiliates
and coaches by building
better boxes. Welcome to
the best hour of your day.
Health, we've got Mike G, we've got Dr. Amy West, and still not a doctor, Jason Fernandez.
Depends on what we're talking about.
I consider myself a doctor. Nicole Carroll's over there. Nicole, can I put you on the spot real quick before we get this going?
Yeah.
Do you agree the level 4 should be considered a doctorate?
Please say no. Thank you. She's on my team.
Okay, still not a doctor, I guess. Still not a doctor. Really? You don't think so?
No, I think we could do one up.
Better than a doctor.
Okay, one more.
Yeah.
A
No, she said there should be another level that is considered a doctor, right?
Yeah.
Yeah.
Okay.
Okay, I'll take
All right,
that.
level 5 it
I'll
is.
take that.
I don't think the L4 is quite PhD level.
Yeah. Level 5.
Level 5.
We're gonna make it
There's
up.
more to come. Or a master coach.
Yep, we have talked about that.
Yeah.
Yeah, talk about
Ooh,
master
I want
coach.
that.
I want
Yeah.
that.
All right, let's bring it back. Inventor of the butterfly pull-up. I forgot about that.
See? I
Did
brought
you
it
do
back.
that? You
I did not.
invented it?
I didn't. I did not.
Oh.
It was
Nicole
from the
Carroll.
She's like,
it was
It's
Brett
hard,
Marshall.
though.
Brett Marshall.
yeah.
AFT? Was that AFT?
Is it
Yes,
AFT?
AFT.
Yeah.
AFT, yes.
Yeah.
Yeah.
He,
Yep.
when do you remember when that happened? 2008 games?
I don't even know if it was the
Wasn't the
games.
games.
He was just doing
a
it.
video.
And he didn't even. He
was
was
on
actually
YouTube.
trying to do the gymnastics kip. He just couldn't, and it turned into that, and that's how it all started. And then I remember I recorded because we didn't have camera phones back then, so I recorded it, and then I would set it up in CrossFit Atlanta. Back then, you know what I realized too? I was talking about this earlier. When I started CrossFit, I was 25 years old.
And now you're
43.
43? Wow.
Damn, you're almost 20 years in.
20 years.
A lot
do
of
math.
us. A lot of that was.
It's
Not
nuts.
good math, but I can do it.
So remember
Yeah.
when it was AFT and OPT back in the day? Like I remember 2008 games. It wasn't like this. I was at home in New York hitting refresh.
It was not like this. It
I
was
was
not.
hitting refresh just to find out where people were on the leaderboard back then.
Yeah.
Now, on my phone, you could
The
watch it.
2007 games, the leaderboard was a spreadsheet, I think, that went out. Like
Were
it
you
just
there
would
at
go
2007
out.
at the
No, it was
ranch?
8. 8 games, 9 games.
And then you go team.
No, I went 8, 9, 10, took a year off. My daughter was born. And then those were individual. And then team was 12, 13,
12,
14.
13, 14. Yeah. Okay.
Yeah.
That's cool.
And then everybody became real athletes and left me behind.
And then I was like, oh, shit, it's a real sport.
Like, oh, man. I can no longer compete with these people.
No, Mike G, legend back then. I mean, I remember I went to CrossFit Atlanta. I was working with Ripito. And you just happened to be there working out. I was like, oh, my God, that's Mike G working out over there.
Dude. It's like
It's
probably
impressive.
barefoot, hat backwards, curled up or something.
You were definitely a turd for sure. But looking back
still
on
am
it,
a little
in the
bit,
moment,
yeah.
in the moment, you were like amazed. Like that's impressive.
How did you find
Yeah, talk to us,
CrossFit?
Doc.
How did I find? I found CrossFit. It was CrossFit Fenway back in Boston when I was in med school.
Oh, shit. Oh, that's old school.
Yes, I was in med school, and actually, CrossFit Fenway at the time was very close to Harvard, where I went.
Yep.
And I'd pass it every
Wait
day.
a second.
Humble
Rush over this. Harvard.
Not
I
only
don't
am
have the
I a
CrossFit cred that he
doctor,
has, so I got to make it up in some way.
Harvard.
Okay.
But it's really close by, so I used to pass it all the time. And I said one day I was like, I have to go in there and try it. So I did, and then I just got hooked, and that was it.
That's cool.
And
So that was probably the original location.
Yes.
Yeah,
Yes.
okay.
It was.
What kind of medicine do you practice, Amy?
So I am what's called a physiatrist. So physical medicine and rehabilitation is the full name of the field. I subspecialize in sports medicine. So essentially, non-operative orthopedic injuries is what I focus on.
How many years did you go to school?
A really long time.
I mean, Fern did too, but he's not a doctor.
Not even close.
I mean, it was like 4 years of med school, 4 years of residency, a year of fellowship after that. So a long time.
That's awesome.
Plus, I had another career before, so I had to go back to school to go to med school.
What was your career before that?
I was a television producer, actually. So
What?
Yeah.
We need
So
a,
how are we
Yeah,
doing?
so
Place
We need a new
I-
camera
yeah.
guy.
I
or you
worked
could find one.
in audio engineering and stuff like that too.
How did you go from that to like I'm going to Harvard Med?
Well, I mean, one is I got sick of the entertainment industry in general, so I was looking for something else. Like, how can I like help people and do like better for the world? And then I got a job as a surgical videographer. And I was like, this
Like
is kind of
Dr.
cool.
Pimple Popper?
Dr. Oz was one of the people I filmed back in the day. Before he was
really?
on TV, I would just film his surgeries and put those together. And
And you're like, I could do this.
I was like, I think I'm on the other side of the camera. It took many iterations to get there, but yeah. So
There's got to be a leap there from
Yeah.
I've seen this, I want to do it, to Harvard.
yeah, I mean, there was a weird period of time where I was in school for a long period of time and just trying to figure out what I wanted to do. But I found my field actually because it's a field of physical function. And I found that and CrossFit at the same time. And the two things go together quite well because it's all about focusing on function, which they feed each other, which is quite nice.
Well, we want to talk to you guys because you guys are like the tip of the spear of CrossFit Health.
Thank you.
Does that,
Yes.
does that make
Is that a
that
question?
road, yeah.
Yeah.
You literally told me
It was
before.
an oddly phrased statement, but
Well, you told me before, please refer to me as tip of the spear. CrossFit Health, over there.
I did.
No, but you guys are really taking this initiative
Right.
and running with it.
Yeah, for sure.
So tell us about what's going on.
So there is a new initiative, and what I would actually like Amy to tell you, because
Cool.
Amy has
Yeah.
been pushing this forward for a very long time, and we finally got it. Like, we finally got this thing, and we're going to launch it, and well, she's going to launch it.
And
Go ahead.
Can I, before you go,
Yeah.
I do want to say this. Like, I met you years ago, and it was always impressive to me that not only you good athlete, father, seminar staff, but you were always like studying like molecular biology. I'm like, this dude's really smart, and it's fun to see. Like, now you've completed that. And was that a master's?
So yeah, I had a master's in exercise physiology, and then a master's in public health and epidemiology, and then and now finishing up a MBA.
Yeah, but I mean, you would always talk about, I'm like pretending I understand what you're talking about, but it's Mike G. Like, I know we were joking, but that's awesome. Like,
Thank you.
I always
Like,
enjoyed somebody challenging Mike G in the nutrition lecture.
Yeah.
And they would say
Like,
something, and he was like, that's
he's
not
one of the
correct
guys
at
that
all.
you would like.
Let me educate you on how this works. And I was sitting in the back like, oh my God, it's happening right now.
He can
Very
turn it on.
professionally, very professionally.
Yeah.
But
you talk down here, but you can also talk
Thank
Yeah.
you.
way up here. So it's awesome to see
Thank you
that.
very
But
much.
Yeah.
Go ahead, Amy.
So we're announcing we're going to be starting a CrossFit Health Medical Society. So essentially we're going to be formally organizing all the healthcare providers who are into CrossFit, essentially. So for years we've been talking about bridging the gap between the healthcare space and the gym space. But as far as figuring out how to actually do that, this is sort of the first step. It's the first step in planning having an action plan and doing that. So what that looks like is we're going to have all the basically any healthcare provider who is involved in CrossFit. We're going to have them sign up, and we're going to start by first networking everyone. Having educational ways to educate each other, educate patients, educate the affiliates as to how they are really serving as healthcare professionals themselves. We, as CrossFit healthcare providers, we really believe that real true healthcare is happening in the affiliates, in the boxes, and we want to try to find the best way that we can affect change as a physician network, as a healthcare provider network, and steer people towards the affiliates, because we really see, as CrossFit physicians, we really see the benefits of what's happening in the boxes, and we want to make people more aware of what's going on, especially in the healthcare system. Right now, many of us work with these big healthcare behemoths, and we're sort of we're thinking differently than everyone else in healthcare, and we want to put all that energy together so we can get have the synergy to steer people towards the CrossFit affiliates. So this is the first step in that, by first getting everybody on the same page and having people get to know each other and work together, so we can really use that energy to push the methodology in the healthcare space.
So any doctor at any affiliate can find out. This will be launched by the time this is airs.
Yeah.
Can sign up and become a part of this initiative.
Yeah, so we're working on the specifics right now, but the idea is if you're a healthcare provider, whether that's physician, NP, physical therapist, etc., if you have some kind of healthcare certification, you're a CrossFitter, you're interested in joining the movement, then you can sign up essentially.
Yep. We'll have a list. We'll have a list of, like, the list will start off fairly narrow in terms of like when we're going to grow it. So MDs, licensed nurses, PAs, physical therapists,
Level 4s.
Level 4
doctors,
Yeah.
psychiatrists, psychologists. So that'll make up like our team at first. And the really cool thing about this is from the CrossFit side is what we have realized is if we want to change the healthcare system, the hospital system, the universities, the student groups, then the best people to go out there and do it are our champions as MDs and healthcare professionals that are already in the community and have been in the community. So they're the ones that are going to do it, which is absolutely amazing. Like this is really their organization. This is their society. We are there as the methodology as CrossFit, but they're doing this stuff, which is super cool.
There's already so many things happening right now in silos, and I have people message me all the time about it. I'm sure Mike gets this too, where people are doing really interesting programs, really cool integrations of healthcare in the CrossFit affiliates, and they just don't know about each other.
Right.
And they want to find out about each other. They want to work together. They want to do research together. They want to educate each other. And this is a way so everyone can be in the same place at the same time.
So when you say change the healthcare system, what does that look like to you guys? Because I hear that and I'm like, is that even possible? Like to what extent do you envision that happening?
Well, I think the first thing is, when I started CrossFitting, 10 years ago when I was a resident, you mentioned CrossFit. It was a dirty word in the medical landscape. And that's changing over time because people are seeing the benefits of the methodology. Now, if we dress it up as something else and don't call it CrossFit, people they see how well it works. So now that I did a talk about CrossFit like 10 years ago, and I would get emails from people in my hospital saying like, "Hey, like don't tell anyone, but I CrossFit too, right?" So, and it was true.
It's a weird, dirty word.
Yeah, and now it's sort of coming to. We're seeing that now that 10 years later, all these principles behind CrossFit, the CrossFit methodology, are being shown to be injury prevention techniques. They're showing to help cure chronic disease. So right now, we just need to make people more aware of that in the healthcare system. And the first way we do that is by being examples ourselves as like healthy physicians and healthcare providers, but then also starting to get people, patients who desperately need the methodology to experience it.
What, obviously you don't have hard numbers here, but so for instance, I have a functional medicine doctor, but we all probably fall in the early adopter kind of group with regard to this. I have no concept of how many physicians in the overall physician network are actually like open to the idea of this at this point. Like I know 5-10 years ago it was zero, handful of people. I know people are coming around to it, but is there starting to be any sort of movement or underlying wave with regard to that, or is everybody still pretty? And the reason I ask that, I see a lot of physicians leaving practices and moving to like cash-based. Like they're just like, I don't want to do this shit anymore.
Yeah. Yeah. I mean, I think that's part of what the beauty of this could be is that, it'd be great if we could all just like open up our private practices and like run things out of gyms, but like a lot of us work for big healthcare systems. So how do we affect change in those healthcare systems?
Right. The
best way to do that is to organize and to group together and find out, okay, who's doing what in my area when we could work together, and we know this great affiliate down the road that we can send our patients to. So this is the first step in getting those people to talk to each other, to promote the methodology and to get people into the boxes. So that's really the idea.
So it sounds like the initiative is like, hey, let's just get the people that agree together. Right. And then these ideas will start to be exchanged, and we'll figure out what the best way forward is.
And they're already ideas. They're already things that people are doing. So let's like take this step back and say the goal of CrossFit Health, and Amy and I have talked about this quite a bit. The goal of CrossFit Health, when we talk about it, is to bridge the gap between healthcare and fitness, right? And so what we're trying to do is we're trying to build the bridge. Okay. Right? So the connection has to happen. The synergistic relationship between the healthcare professional and the coach and the affiliate has to happen. But how do you make that happen? Right? And it kind of has to go both ways. But one of the ways that we can do it is by getting more healthcare professionals, more of these doctors, more of these physical therapists, more of these nurse practitioners, PAs, psychologists, psychiatrists into the community to really understand the efficacy of CrossFit, and then connect them with affiliates, connect them with coaches, and create that handshake, because they're both going to be needed. Like we like to say all the time that doctors treat symptoms, right? And it becomes this very negative thing. But in reality, we need that, because some of those symptoms are life-threatening. When
it's a real thing.
It's a real thing.
Yeah.
Some people actually come into the clinic and they have like life-threatening symptoms. So we
Burpee's
need
not
that.
gonna
Like, it's
solve
going to
that.
have to happen. You know, so this idea that we're still going to need people to prescribe medication, but it's not the lack of medication that got people into the clinic. Right. It's the lack of the lifestyle.
Right.
It's those lifestyle behaviors that got them in there. So we're still going to need all that stuff to happen here, but then when they're ready and we can get them in here, we got those symptoms under control. Now we got to start taking care of that underlying issue, and that's where that synergistic relationship can take place.
So I'll kind of, what does that look like to you when you're talking about that synergy? When you're talking about the handoff, like, are there people already doing this, like coaches, doctors, like where they're at that? I mean, I've heard, but I don't really know what's going on there.
I mean, so I can say, there are a ton of physicians and healthcare providers who are doing these things in silos all over the place, and a lot of them reach out to me. But I mean, they're already doing it, but they need more support, and they need to know who else is doing similar things. I've spoken to a bunch of people here who, like, someone's running a program for cancer patients out of their gym, and these nurse practitioners want to get people in the boxes, and it's just, we need that crosstalk. But I'll say, like, what I do just locally is that I know a lot of the gym owners in the area. I know physical therapists that I trust, and when I have a patient who I think really will buy into it and who's really invested in themselves, which is not a lot of people sometimes, but I have this informal network that I activate via text. I'm talking to that person, I'm sending them to the box over there. So looking at a way to make that a more formal process.
I guess that was the follow-on question is, like, when on the physicians end, what is that when you're like, hey, they need support?
Yeah.
I know the box owner end of that, but like, what support does the physician in? Is it just a connection point?
Well, so
or is there are the things that box owners can do to support the physicians in that endeavor?
Yeah, so I mean, one is, I make as a physician, I make recommendations, but I do not have the time, nor do I have the skill set necessarily to make those recommendations habits for patients.
Got it.
And that's where the affiliates really step up to say, how can we make these recommendations habits? How do we form these healthy lifestyle changes in patients? Because I see people for 15 minutes. They're in your gym every day, right? So that's the first step of that. And it goes both ways, right? If there's something that's happening in the gym and an injury or something, you guys shouldn't be handling that. Then you know who to trust. A lot of times people will ask, like, I have someone here with an injury, and they've gone to 5 physicians who told them they should stop CrossFitting, which is one of the worst things you could tell people. So is there a physician in my area who's going to tell them, to keep CrossFitting, but how to do it safely? And this part of this is making that network available to you, so you know who's going to help you, keep your affiliate members healthy.
Right. Okay.
You remember the talk and article? It was like fitness, health, and luck.
Yep.
Right. So you can
if you've not read that article, you absolutely need to go read that article.
Yeah. You can be extremely fit and you can be healthy, but things can still happen.
Shit happens.
Yeah.
And when those things happen, and you're an active CrossFitter, where do you want to get back to? You want to get back to the gym. You want to get back to the affiliate, right? So how does it help physicians is that when those things happen, who can we refer these athletes to get them healthy again so they can get back into the affiliate?
Right, so the doctor's like, hey, you might walk again. I was like, well, I was planning on back squatting again. So
Right, exactly.
Right.
Like, don't,
Right.
like, you know.
It's like-
Right.
Yeah.
And like, so that's the synergistic relationship. It's like,
Right.
it's not like we're always going to need doctors. We're always going to need that side of
Yeah.
things. And it's so those two things need to work together. And even in terms of like chronic disease, I think the biggest mistake is thinking that one side is going to fix the problem. It's like, that's just not the way it's going to be.
No, you need
everyone
both.
has to come together to fix this problem.
You need both.
We all do.
Yeah.
Yeah, you need people to deliver high quality training, but then you need healthcare professionals which is whatever, like when a doctor tells a patient to do something, like, that's what I'm going to do.
Yeah.
And that could be good, it could be bad. Or
Right.
they're like, hey, you need to lay off exercising for a little bit. I'm like, can we rephrase that somehow?
Right,
like,
right,
that's kind of an
it's-
insane statement.
Yeah.
You know?
Let's think about the new goal, right? The goal is 30 million active CrossFitters by 2030. And then just look at basic statistics. Like, what are the basic chronic disease statistics in the United States? At least 60% of the people have at least one chronic disease.
Right.
So how many of those 30 million people do we think have a chronic disease? At least probably 60% or so, right?
And then, the majority at this point.
Most of those people, and just the way it is, most of those people aren't knocking on the doors of gyms. Like, they don't know what to do. They're a little afraid. They're a little terrified.
Yeah.
Who are the gatekeepers to those people? Like
Physicians,
Right.
oddly enough.
Yeah,
Like,
it's
crazy.
not
Exactly.
oddly enough, but like,
Yeah.
there's just not enough people who understand that and be like, hey, yes,
Right.
we do need to treat this, and then you need to go create better lifestyle.
Right.
Yeah.
And all the time, it's diet and exercise. But like as physicians, we don't know what that means. Like we say that, and but it's just a statement, right? People really need a plan. Like, how do I do that?
Yeah, you need to do that. Here's who will help you with
Exactly, and that's
Here's
the key,
expert
right?
in that area.
Correct.
Right.
Like,
Here's here's the person who's going to help you. Here's the person who's going to show you how to do it. And when I tell people to go to CrossFit, I'm like, guess what? You don't have to think about anything. You show up, they will tell you what to do every day.
Right.
Just show up and they'll steer you. I have a lot of patients too who are finishing up like physical therapy, and it's like they've made great progress, and then their insurance cuts out, and it's like, okay, they still need to be practicing those skills. Where can they do that? And the affiliate's the perfect landing spot. So,
what? Probably. Well, both of you could speak to this. So obviously, CrossFit Health it's been many different things over the years. What has that? I don't even remember what the original intent of CrossFit
Exposing
Health.
the problem, right?
Okay.
So
It was just an awareness
You got to
thing.
expose it,
It
right?
was an awareness thing.
Yeah, it was
Okay.
awareness. It was a way to network physicians. It was also a lot of sort of exposing some of the influences behind
Right.
Research.
And stuff like that. And we did a lot of talking.
Dirty
and,
science. I remember. Yeah.
and we had a lot of interesting speakers and stuff. But as far as like action plan, I think we've always been looking for some way to organize and do stuff. As physicians, we're like, let's do stuff, yesterday. So
Right.
we've been waiting to kind of launch for a while.
Dude, one of
cool.
the lucky things is, we've had just the most amazing. All the healthcare professionals. Don't get me wrong, but the original groups of MDL1s
Right.
that went through that and stuck around and have just been willing to do anything for this community has been outstanding. Like, it's incredible.
Is that going to come back?
That's what the society does, right?
Okay.
Like, the society is like
Did you ever teach those?
the MDL ones.
Yeah.
No, I never
I did
did,
not.
but I was at the DDCs often.
Oh, got it. Okay.
Yeah. A lot of the MDL ones were local,
California.
Like they were like Santa
the high
Cruz,
end
yeah.
local, like the old school local Santa Cruz people.
Yeah. Most of them were at the ranch, correct me? If I'm wrong.
They were at a lot of them were at the old offices, the Scotts Valley.
Yeah, okay, got
Because
it.
we would have the MDL one, and
Yeah,
then
yeah,
the DDC would be on the side of it.
Got it.
But
Okay.
that's going to come back.
The course itself.
Yeah.
So the course is going to be a little bit different.
And for the record, it was just the level 1.
So
for doctors,
the original
right?
course, the main idea originally was that Greg was giving it out, and it was free for doctors to come in there, which was like
Where does
super
Coca-Cola
smart.
fall on this? Is that good for you?
It's good for you. We're going to take your advertising dollars, and it'll still kill you.
Yeah, it's good
It's
as long
coffee.
as they.
It's coffee. Come on.
Carbonated, coffee.
It is coffee. I don't know what to tell you.
I don't know. I think it's.
It's
Pretty
Coke.
sure that's good.
It's delicious. I've got French fries
I'll
back
give you
there too.
Pepsi, maybe. So anyway, Greg was giving them out for
He's
free.
giving away, right? And that luckily for us, that created our core group, right?
Yeah.
And which has been amazing, and that's what we've grown from. And then we came out with the HCP L1. It continued to be just a regular L1.
Healthcare practitioner level 1.
Healthcare practitioner L1. We continue to be a regular L1, but we brought everybody there to network, and that was great too.
So it expanded like the people that could take it.
Right, expanded. And now what we're doing, we're like, okay, what we really need to do is come up with something that is directed towards this group of healthcare professionals that we just talked about, right? So we've created this one-day course, and the one-day course is it's like the fundamentals course with 2 additional
That's what I was
lectures that
gonna ask
speak
you.
directly to healthcare professionals.
So unique lectures.
It's very unique lectures. They're the only ones that will get it, right? Now, the cool thing about that course is the money that is applied to that course, if they eventually want to get their level 1, it can go towards the level 1.
Oh, okay.
So the idea is let's give them something very specific, still create this event where they can network with each other. But one of the best things about doing that is the integration into the community.
Right.
We get them into level 1. We have potential affiliate owners and coaches that now they get to interact with in that amazing level 1 experience together. Like, you want to talk about creating a bond between healthcare professionals and the community. What an amazing starting point at that point. And the cool thing is, like, just like the fundamentals, you essentially are getting 2 courses for the price of 1 if you want to get to level 1. So it's super cool.
Is there a workout at the HCP level 1?
No, we don't work out.
It's just lectures.
No, we work out.
There's a workout there?
Yeah, there's
Is
a
it the
workout.
day 1 workout? Or
It
you
fucking
I don't
better
know.
be a workout.
No, I just... For the reason being, I
I'd be
didn't know if it was...
disappointed. I'd
We
be
need
like,
to educate you,
of course,
but I think,
bullshit.
like you're saying, Mike, there's a magic to that.
You have to work.
Yeah.
You have to. You can't.
Yeah.
I don't. That'd be like just giving the lecture. Be like, did you do this? You're like, no, but it sounds good.
But,
You're like,
but I mean, for some of
that's
these
where you
doctors,
actually experience
the
it.
education might be enough.
No, I don't think
They
it is
love,
enough.
I mean,
because
you would think so, but man, here's something that's super interesting, and then Amy could talk about this too because she experienced it. But I wasn't sure what to think about the MDL2s, and I was
I
like,
didn't
I
know
don't
there
know.
was an MDL2.
It was at the ranch, and
one.
I was like, I'm not sure. I'm
You
not
are
sure what
one?
this is going to be and how this is going to go. I don't know how many of them are coaching. To my surprise, a lot were coaching, right? The other surprise is you guys. One of the things I realized about the level 2 is that that material, that education, can be applied to
Anything.
many professions.
Yeah.
It doesn't matter. When I would go to big parent-teacher meetings at the school, and I'd listen to these teachers, and I hate but I'd listen to them speak to the crowd. I'm like, oh man, this person needs to go to the level 2. I'm evaluating their presence and attitude, their teaching skills, their communication, and I'm like, you are not communicating effectively
All
at all.
of parenting can be improved at the level 2.
Anything can be improved there. So,
Anything.
But as physicians, we are educators, right? And I was surprised actually at the L2 to watch some of my colleagues who I thought would really crush it have a hard time just explaining like an air squat, right? And it's like you're telling people, you're teaching patients all day, or they were just talking a lot.
Yeah.
Which is just people lose you
Very
when
common.
you do that, right? So, so. I'll drop it on there. So while I was in med school, I did an education degree at Harvard as well.
Oh, second degree at Harvard?
Yeah, so
we got a badass over here, everybody.
but I say that to say I learned more about the art of teaching at my L2 than I did during that year at Harvard. So
you wrote about that.
yeah.
You wrote about that afterwards.
I did, yeah.
You still don't want to call me a doctor.
But again,
you'd be
going back
surprised,
to we have said this time and time again, that is probably I'll take that soft. It is the most valuable course, the level 2, that CrossFit offers. There is, because there's
Practical
so
application.
much packed into that that's hard to define and hard to explain to people. There's so much there. I think everybody should take it multiple times.
It just makes you a better communicator.
I mean,
Oh my
Doesn't
God.
matter who
I
you're
see
talking
that
to.
should be mandatory for medical residents, in my opinion. But
And so when we were thinking about, all right,
It's done. We're making it mandatory.
we're gonna change and do the HCP fundamentals.
Yeah.
We were like, we're not changing the level 2. The level 2 will, because it's perfect the way it's amazing.
yeah, and
I think there should be. I think there could be some content changes in there, but the overall format.
I mean, in
agree with
terms
you.
of changing it for healthcare professionals.
Correct. Yeah.
Yeah.
Oh no, it shouldn't be different.
They're still out on the floor getting the
Yeah.
feedback.
Yeah.
Did you know that most fitness businesses lose 13% of their clients every single month? Wodify ran the numbers and found that Wodify powered businesses keep 96% of their clients. As a 14-year affiliate owner, if you can have a 4% or less churn, you will be crushing. That's why Wodify calls itself a customer retention platform, not just any CRM. They've released the fitness industry's first retention tool called Retain. Retain can predict when your clients are at risk of leaving your business and allows you to catch them before they churn. With Wodify Retain, you can increase your revenue, stop losing clients, and build a stronger community. Go to wodify.com/podcast and book a demo and give Wodify a try today. And the best part is you'll get 50% off your first 3 months by using the link below. Join the thousands of businesses that have already transformed their operations.
The other cool thing about that, the other cool thing about that course I forgot to mention is bringing in that original group of MDs, and they're going to be part of our seminar staff.
That's
so
awesome.
You're going to have doctors and these healthcare professionals being taught the fundamentals of CrossFit by doctors.
Do they have to go through the candidate process?
They will go through.
Do you know the progressions?
I mean,
Amy, push press?
I mean,
Dude.
I could do it.
No, you.
How bad was the meeting? It
was me. It was me.
Were you there for that,
So
Mike?
during residency,
was there
had
for
people
that.
do that to
We
me.
had-
and
Oh,
we're good.
well, no.
Yeah.
So that's not how it works. So I blew it, and then
that's right. That's
I came
right.
to you
That's
next.
right.
I
That's
came
right.
to you
Hey,
next.
That's
We had a
right.
team meeting last week, and we had to say our most embarrassing.
That's right.
Oh yeah, was your most embarrassing professional moment? I was like, for sure, right there, that was it.
So
And
you
I've done
weren't
some
at that
dumb
one.
shit in my life. That was the worst. No, he
Yeah.
was. So that
right.
happened in my second one. Mike G was there for the third one, and it was funny because you're like, dude, it's really refreshing to have somebody just rip off the progressions.
That's what it was.
It's like that, and I was like, hey, full disclosure, I did not turn the radio on for 4 hours driving here and just recited the progressions because I blew it in number 2. And you're like, well, good for you.
In medical school and in residency, we call that getting pimped. I don't know what you guys call it, but like when an attending will be like, tell me, like, name 3 reasons for this or whatever. So we're used to it.
Good.
Yeah.
You should do that.
I like that.
I was talking to affiliate owner that they're like, my coaches hate it. I'm like, do more of it then. Like, they should just know. Like, there's nothing like getting put on the spot. You're like,
Yeah.
Oh, yeah.
You'll
the
never
only
forget
reason
it too.
Yeah, the only reason you're mad is because you don't know.
That's it. That's it.
Yeah.
Talking about practical application.
Yeah.
Do you have an example of someone you've met as a patient?
Yeah.
Obviously, HIPAA and all that.
Yeah.
But that you've pushed to CrossFit and
Yeah.
have seen success from?
Yeah, so I mean, I've seen it in 2 different aspects, but for example, I work a lot with people with various physical impairments who have had a catastrophic injury, some kind of life-changing thing, whether amputation, spinal cord injury, etc. And they're inpatient rehab for a long period of time. They make a lot of great gains, and then it's like, okay, well now what? Like, they want to keep building on those skills. They want to keep learning and practicing, like transferring it out of a chair, or like getting
which is hard,
in and out of the in and out of the shower, things like that. And once those rehab days end, it's like, okay, well, where can you go? And there's some great programs, and certainly in Boston, there's some great things going on. Is now transitioning those people to do regular workouts, and for adaptive athletes, for example, is just one thing. But that I've seen really, they maintain their skills and improve their skills. I mean, I've seen people with multiple sclerosis essentially exercise their way out of that. I mean, they don't.
Wow.
They
That's
still
crazy.
have multiple sclerosis, but
Right.
their deficits and their impairments are much.
Their
much
functionality
less.
is basically at full capacity.
Yeah, so things like that, where that happens all the time, or people with chronic back pain who think they're never going to do anything again, and then all of a sudden they're lifting and stuff like that.
At an affiliate, the number, at level 1, it's like, who started CrossFit with back pain?
Right.
Who's
Yeah.
still got
Yeah.
back pain?
Yeah.
It's like, these movements are rehabilitative in nature.
Right, and I think
Right?
that's, people don't realize that. So another thing that's really interesting, what I've seen from my colleagues, is that, the physician wellness piece, we've really, as CrossFit physicians, kind of cornered that.
Yeah.
And there's a huge problem right now with burnout, and, physicians are overweight and unhealthy themselves, and CrossFit physicians have figured out how to prevent that from happening. So, patients tell me a lot, my colleagues tell me, like, what do you do? Because I need to get on that, So
It's unfortunate that is a thing.
Yeah.
But it's no different than a trainer, right? Like there's a certain level of credibility that you will get by looking the part.
Exactly.
And people don't like it,
Yeah.
but dude, it's the same way in the military, for good or for bad.
Yeah.
Like,
How'd you make it so far then?
that's a great question. Yeah. But
Yeah.
again, like, I cannot tell you the number of
You got kicked
doctor's
out.
visits I've had over the years. And I'm like, hey, you need to do this, and I'm like, I'm not taking any advice from
No.
you, man.
Exactly.
Like, you are
I saw you smoking a
45
cigarette.
pounds. I'm like, you're 45 pounds overweight. Like,
Yeah.
you clearly don't know anything about this,
Right.
and I'm sure you're a great doctor and a practitioner, but like,
Yeah.
you don't know what you're talking about.
Right. And
I was talking to this. Sorry, but I was talking to this dude at the health booth, and I talked to him last year. His name's Bill Bowman, and he was telling me a little bit about Billy B. What has happened to him over the last year with his doctor, and he goes in and he's hit a certain age. He's in his 60s, and all his markers are amazing. And the doc's like, we're going to prescribe you statins. And he's like, well, wait a minute. You just told me all my markers are great. He's like, yeah, but you hit that age bracket.
That's an insane statement.
And you're like,
Okay.
What?
It's a choice.
That's like a CrossFit coach being like,
You're like,
we're going to
that's a
start
choice.
scaling
Yeah.
you.
Not
Yeah.
necessarily a good one,
I
but
can
it's
go
a choice.
RX.
Yeah.
But you're 60 now.
yeah.
So you have to go 65.
Yeah. And this is one of those things. It's like,
Well, that same thing happened to me when I exited the military. You have to do your exit physical.
When you get
Yeah.
kicked out.
Right. When I did my exit physical, I think it was like overall high cholesterol. She's like, yeah, I'm like 35 at this point.
Yeah.
yeah.
The nurse practitioner that was talking to me, overweight, not a shot at her, but like, she's talking to me. She's like, you need to do this, and I'm like, I have zero other mark, and we're not talking about like high cholesterol. I'm talking like
Just not normal.
Right.
not 215,
Yeah.
something crazy.
Yeah.
And I'm like, why? I'm like, what other marker is off? She's like, well, yeah, but it's this one. I'm like, right, but could you look at everything else? Like, if
Yeah.
you can find like somebody that died of like one bad marker, and that's probably a thing depending on what we're talking about. But I'm like, I'm not taking
Right.
medication. Like, I'm not having
There's
that
so much
conversation.
to
with you.
unpack
and
with
if
the
you're like,
cholesterol
you know,
stuff
and in that
anyway.
Well,
situation,
but that's before we talk about that.
Yeah.
But that I'm sure that happens a lot.
Yeah, and this is society's hoping to help with that problem, right? So you have some.
And I also want to. Sorry, I also because like I don't want to poo-poo doctors. Like going back,
There's
we
protocol,
need
and,
doctors.
and that from doctors that a lot of doctors that I've talked to, like they're actually a little afraid to go against the protocol.
Exactly.
I'm sure.
Yeah, you know, and that's how I think about this too. Is that, you know, there's kind of two ways of going about changing medicine, and one is like revolutionary, and we can just like burn it down and start again, which, you know, obviously we can't do that. So this is more of an evolutionary process, right? We start networking, we start talking, we start thinking about, like, we all think outside the box, pun intended, you know, and now if we can sort of network to affect change in small increments, that's how we go about changing things, unless we just burn it down and start again, which unfortunately we can't do, right?
Yeah.
So in that evolution, cast that vision. So we're kind of in it. We'll call it evolution one, version one. What in your mind? What's 3, 4, 5 potentially look like?
I mean, you know, ultimately, if we can get enough data. So part of this too is we network so that we can gather data, right?
That's a good point.
And ultimately, you know, the data translates to money, and money talks, right? So if we can have insurance companies picking up this as a methodology, we can have employee wellness, you know, initiatives that are CrossFit based. Ultimately, it'll steer people towards the box. But right now, we need the data to show that it works, and that healthy people save money. Ultimately, money talks, right?
It's
so
ironic that you say
cost
that.
effectiveness of health.
Right.
Yeah.
It's ironic that you say that because CrossFit, this whole thing is born out of data. Measurable, observable, repeatable. And in the same breath, CrossFit at large, we are the masters of anecdotal evidence.
Right, exactly.
Which is just like, hey, it works. It works.
Right.
And they're just like, where's the numbers? And I'm like, shit. You know, like, that's really frustrating.
And
It's
that's,
really
It is
frustrating.
that's part of this
100%.
too. And like part of this too is that we want to provide people with information. So I love when people say to me like, CrossFit, that's dangerous. Boom, watch me go. I have all the data to show you that that's
Give
wrong.
us if someone's tuning in, but let's get a clip here. Hey, Doc.
Yeah.
I'm willing to do CrossFit, but it's dangerous.
Well,
Oh, really?
We got to work on that.
yeah.
Just don't start with the side.
Yeah.
What's that called? Your bedside manner?
yeah. Well, ultimately, so CrossFit is based. The principles of CrossFit, constant very functional movement, high intensity, are all things that are scientifically proven to actually prevent injury. They're all of those things are basis of injury prevention protocols. Plus, the idea that you're doing functional movements throughout your whole day, so you need to be practicing those in order to maintain your functionality throughout the rest of your life. When we talk about injury data, actually the injury data shows that roughly the injury rate is 3.1 per 1,000 training hours, whereas in something like running, you're looking at something that's almost 12. It could be up to 9 to 12 per 1,000 training hours. So 3 to 4 times higher in things like running, which are commonly encouraged and people do every day without thinking about.
Right.
So actually CrossFit, the injury rate is actually relatively low compared to other sports and lower than most sports. So just scientifically, there is actually no proof that it's causing injuries.
Yeah,
In fact,
I played basketball. I was injured infinite number of times.
That's
playing
like the most
basketball.
unsafe thing in the world. Recreational
Right.
basketball will kill
They
you.
say in the
I don't.
military,
I,
right?
I do not
Yeah.
do recreational basketball. I'm like, that is like
Yeah.
stepping on a landmine. I'm like, I'm not touching.
We
that
had to
with
make
10
him
foot
stop for business. We were like,
Yeah.
we can't get you hurt.
but there are tons of studies that show that's just not true, and the data's there.
It's just
and it's
so
yeah.
spoken, right? That
Yeah.
it's become a truth, even though.
Right, exactly, and there's tons of reason for that. But but ultimately, that the data actually proves the exact opposite. And when you examine multiple injury prevention protocols, the CrossFit principles are actually the basis of those. So actually preventing more injuries than we cause, I would argue.
Your
is
talk
part
is
of-
on YouTube, right?
Yes.
What's on YouTube?
Yeah.
She's presented this multiple
Oh,
times.
so
Yes.
we'll link
Yeah.
it.
Okay.
Do
Yeah,
you have your
so
YouTube
So that was going to
channel?
be the follow-on question.
Yeah.
I'm assuming part of this is distributing that information, so
Right.
it's just not me parroting. And they're like, "Yeah, cool story. Where's the
Right.
data?" And I'm like, "Here
Right.
you go."
So I mean, that's the thing. I think there's a need for some, things that you can either present to patients or you can talk to other healthcare providers about to say, actually, this is not true. I mean, here's the proof. So that's part of this too. Is just educating each other, educating patients, educating the healthcare system. How can we get everyone on the same page and just dispelling myths? And that's like the first step. Is just getting people to get all the false ideas out of their head and then start implementing it. So getting physicians in the box is the first step.
There's a lot of data out there. It's all,
Yeah.
but like Amy was saying earlier,
Yeah.
it's done in silos. So it's like,
Yeah.
how can we how can we get everybody together and say, hey, these are the best practices, and let's have everybody do it in a similar way, so that we can kind of organize and collect the data as one massive data set. Because there's this group out of Michigan, and we just had them on every other month. We do this thing called Grand Rounds, where healthcare professionals come in and educate our group of healthcare professionals. So they're kind of educating each other.
Cross training.
And and that'll be eventually that'll be part of the society, right?
Yeah.
So we had this group out of Michigan, and they run this study called the Capable Study. And essentially it's taking cancer survivors and putting them through 12 weeks of CrossFit. And because you got to think, when you come out of cancer treatment, there's a lot of effects there, right? A lot of it has to do with loss of bone density, increase in body fat, and then with that,
your hormones are a disaster.
Hormones, but when you got to think, then you increase body fat, low density, loss of movement, and then this massive cascade of metabolic issues start to happen, right? So it also starts to snowball. So they put them through 12 weeks of CrossFit, and the impact on their physiology was insane. Yeah. But the other cool thing, when you were talking about what happens with affiliates, the other cool thing was after 12 weeks, it was somewhere around 50 or 60% of the people that went through this program stayed with the affiliate.
Yeah. That's cool. So they were not CrossFitting
They
prior
were not.
to
That was part of
that
the
was my second following question, just for clear, was what's the healthy user bias, and were they
were
previews? Okay, that's even better.
They were not.
Yeah.
Okay. They standardized it to prevent bias.
And while I've been at the games,
as it should be.
While I've been at the games, I've talked to at least 3 different people who are doing work with cancer patients who don't know about each other. So this is a perfect example of
CrossFit, Mojo. I know Nike has an initiative too for battle cancer.
Yep, Scott Briss is doing some amazing things with cancer patients.
Well, as you're saying, the collection of the data and distributing that, I'm going through my mind as an affiliate owner, this is also how I educate, preemptively, my client base or potential prospects who they're I don't want to get injured, this isn't for me, and I'm actually, here you go, you should look into this, and if you have questions, I'm happy to help you out with it. So I going back to it's going to be a collective, it's going to have to be both parties, and that's, as an affiliate owner, still I'd encourage you guys, don't limit distributing that information to just send that out to everybody.
Absolutely.
The good affiliate owners will know what to do with it. If you don't know what to
Absolutely.
do with it, just share the information with people, because that's how one of the hardest things about being an affiliate owner is kind of that bridge to nowhere. Somebody comes in and they're hey, I can't do this for X, Y, and Z reason. Even though none of those are true, and no amount of me trying to convince them that those are not true is going to work. What I need other things to help them build this bridge, which is this information. Okay, maybe those things are true, but here are all the things that we could utilize to work around that. And now they're more willing to make the leap because they're you've presented other information that mitigates my kind of untrue fears.
Totally.
Right in that scenario. So
tying this into when we had Austin on a couple weeks ago, he spoke a lot about, the goal being your credential will be available and it'll make it easier. If my mom lives in another state, hey, mom, check out this affiliate because they have a level 4 or a level 3. And I think that can probably tie into what you're doing.
Oh, yeah, they have a doctor
will have more
on staff,
confident, whether it's a doctor on staff or the box is owned by a level 4 or a level 3, they feel more confidence in sending people there.
Yeah, or an MDL1
together,
or whatever.
Same for us as physicians. We want to make sure that patients are getting the experience that we expect, right?
Yeah.
So, that it would help, to have that kind of, that network would be great.
So what can affiliates do to learn more about this? What can affiliates do to be involved in this? Yeah. What are some of the next steps? Keeping in mind this is 5 weeks out.
Yeah.
So you got to forecast.
Answer that question.
What can affiliates? Well, there's a lot. So I'm going to tell another story.
Please.
So
what's it?
There's another guy, Dr. Jeff Meyer in New Orleans.
Great state of Louisiana.
He also created, oddly enough, a 12-week course, right? And this 12-week course takes people with chronic disease and brings them through 12 weeks. And as long as him, as the MD that's kind of championing this course, does, I think, 6 lectures about nutrition and fitness and their impact on chronic disease. And then the head trainer of the affiliate can bring them through 3 workouts a week for 12 weeks. These patients can go and get reimbursed by insurance.
Oh, really?
Right?
And there's other companies doing that these days, right? reimbursing
it's a mess though. It's
Yeah.
very convoluted.
But the thing is, like, it can be, but from talking to him, like, he's figured out a pretty interesting way to do it that he's been able to replicate over and over again, and it's been fairly simple.
Yeah.
with other boxes.
With only the box there in New Orleans.
Got it.
But when talking to him, he's like, look, the challenge is the legislature in the states is a little
Correct.
bit different, right? So one of the things that what I would like to do is to figure out, okay, how do the rules differ? And usually it's like, does it have to be an MD? Can it be a PA? Can it be a licensed nurse? Do they have to work under an MD? Like, that's really how you have to figure out. The rest of it, from what I'm understanding, is relatively simple and replicable, right? So my point to that is, what can affiliates do and how can they get information? Well, once we start putting this information out, it doesn't have to be the MD or the healthcare professional that initiates these programs, right? Figure out what the legislature is in your state. Take a look at the program once we put it out there as a best practice. Go into the community, or your own community. I mean, most gyms have somebody
doctor,
in there
for sure.
that's a doctor, a PA, or a nurse.
Right.
They just do.
I have
You may not know it.
a dozen.
Exactly.
Yeah.
So like, search your own community first.
Yeah.
Tell them, hey, this is something we can do. And the cool thing about it, like, in this particular program, everybody benefits, right? The doctor makes a little bit of money.
Right.
The head coach makes a little bit of money. The person gets an amazing
Reduced
results.
cost.
Right?
And reduced cost because
And
it's
reduced
offset
costs.
by insurance.
Right.
Right? Exactly. The affiliate owner off of the program, because it is a paid program that they get reimbursed for, so the affiliate owner makes the money. And then most people, a high percentage of the people, stay in the affiliate because they're getting amazing results.
I think that's great.
Right? So one of the things, every time I'm at an event, I get a lot of affiliate owners say, like, what is CrossFit going to do to help me get these people in the door? And it's like, we can give you best practices, but in reality, like, you got to do it. You have to do it.
You got to do the work.
You
like,
just
you have to
have
like
to. You gotta
literally
figure it
go
out.
do that.
Yeah.
You know, go figure out how, like, what grant money is available. You know, go talk to your local public health system. See what kind of scholarships and money they have available. Talk to your members. Are we willing to do a fundraiser to come up with enough money to get these people? There are ways to do it and really make a difference.
And this is like it's the frustrating part, because I know those things are out there. They're available. What typically happens, the amount of red tape and administrative juggling that you have to do for a lot of these things is where most people fall off. Like, I'm going through a whole application process to do some work with the VA. It's going to take like 6 months.
The VA is going to be.
It's going to take like 6 months. I have high confidence that it will work.
Yeah.
But the issue is, most people are not going to put up with 6 months of that in order to make it happen. So it's like this weird, like, it's there, but it's just like I struggle to put up with the pain in order to make it to the end.
So I mean, I've done sort of an informal process with the local gym that's near the hospital I work at, the CrossFit Sanctuary. You know, I started just saying, like, hey, everyone in my office, like, hey, we're going to do CrossFit workout today at 4 o'clock. And I got, you know, a group of 10 people. We did an informal class. Like, we had 4 or 5 people sign up that day. Now that person, another person he's getting his office to come and do a CrossFit workout. So it sort of just started kind of very grassroots instead of going through like this whole formal process. And then ultimately building a relationship with the health system is super important, because you get the physicians and the healthcare
they can
workers.
help push that through for you.
And then the patients follow. So you can start off sort of informally and then kind of build from there if you know the people in your box who have access to those people.
Yeah, and the struggle, practically speaking, I get the struggle is that, because we deal with this all day long, it's just like, we have to get gym owners healthy without those things first.
Yeah.
And then it's like, cool, now you can go pursue these other things. And a lot of times we see them in reverse order, and it's catastrophic, because they're they're pursuing this good idea with not enough time, energy, and resources at the expense of their main thing. And this is like, it's always painful for me to tell gym owners, it's like, I've got this idea, and I'm like, great, put it on the back burner.
Yeah.
I'm not saying it's not a good idea. You're not capable of facilitating and doing fulfillment on that.
It's like, dude,
I want you to. It's like, just like I want you to snatch your body weight, but you're not ready.
It's like,
you know,
you can't help, even on an individual level, right? Like, if you're not pretty solid yourself, don't go try to help someone else.
Right.
You know what I mean?
Yeah.
And that's part of what we're doing. We're trying to create these really healthy affiliates, and then we're like, now I want you to start having greater impact. Here's some really solid mechanisms for which you can do that, to really start to get out there and do that.
Yeah.
And I have a good confidence that we're not far away from that, where people will have a large conglomerate of gyms that are doing really well,
Yeah.
that will then be able to access that and take advantage of that. And then I think that starts to snowball really quickly. So
Yeah.
these are the things that are cool about what you're doing, what we're doing. It's just like, we're getting them ready and then hand them off. And be like, now go do the really important work.
Yeah, you're
which is
healthy,
like,
you're ready, let's
now
go.
you're ready.
Yeah.
Now let's turn up the intensity on that. And like, that's what I think is really cool.
Yeah.
So I think that's awesome.
So where can people find out all about it? CrossFitHealth.com?
Yeah, so you can go CrossFit.
Mike
what is it?
G
CrossFit.
_AF? Is that it?
Yeah. Go to that one.
West
CrossFit
MD.
was it /health / what does it go? /
Forward slash.
/ health.
Google.
No, CrossFit Health. We are sunsetting the CrossFit Health Instagram, but
Okay.
we'll put out all the posts on
Is that a
that.
nice way of saying
It's
shutting
going to
it
be
down?
gone.
Yeah.
And
Sunsetting. I'm going to use. Hey,
new
Ferg,
term.
I'm sunsetting this
it's
relationship.
kind of like
fair enough.
slowly going down.
Yeah.
But all that information will then be put into CrossFit training and CrossFit's
Because it is all
main.
one and the same.
Well, and also like the reach is huge.
Yeah.
It's much bigger if you just run it
much
through
bigger.
the main channel.
And once we come up with a cadence, like that information is just going out.
Right.
So check those things.
Yeah.
You know, when it comes to the society and the new fundamentals course, like we're going to put that out everywhere.
Right.
Like we want everybody to know about that stuff. Right. So that'll go out on multiple channels. Like that'll be a big push everywhere.
Cool.
But if you have questions, you have any questions,
Mike G _
you can go to Mike G _AF. No, just Mike.giardina@crossfit.com. You can have questions.
We'll,
And if
we'll
it's-
spell that name for
Yeah,
you.
yeah.
Nobody can spell that name. I still can't spell
and
it.
if it's anything like that I need to get Amy involved in, we can get her involved,
Yeah.
and especially when it comes to society, because she's going to be the
I like the
expert
society.
there.
It seems
Ooh, it seems
secret.
like secretive. Like you have
Yeah.
to
Society.
can't
Yeah.
talk about it.
Yeah.
Handshake.
Yeah.
It's going to do some. I mean, I'm stoked for it. There's going to be some cool stuff.
No, this is awesome,
Yeah.
and we're glad we had Mike on. I'm even more happy you dragged her over here because
Yeah, me too.
hard.
Otherwise, we would have been done in 12 minutes.
well, we got a Harvard grad on that.
Yeah.
Amy's
Double
been on the
Harvard
show
grad,
before,
right?
but,
Yeah, double
two,
Harvard grad.
2 degrees.
but to
Yeah.
have her on again, you're
Yeah.
awesome.
Appreciate it, man.
Yeah.
Appreciate
Yeah.
it.
Yeah, it's very cool to see.
Check this out.
Yeah,
Yeah.
people like you in the space. It's exciting, and I guess
She's
the
been
frustrating.
fighting the battle, dude. Like on all
Dude.
fronts for us. It's
But
pretty
that's
awesome.
what it takes.
Long
It takes
time.
people like that who are like,
Yes.
"Yo, I'm in it for the long haul,"
Yeah.
and
Yeah.
that's eventually they break through and like, "Look what they did." And I'm like,
Yeah.
"Let me tell you the story."
It's just
Yeah.
like, because I believe in it, you know?
Yeah.
That's it.
So, yeah, if you guys have more questions, reach out. You can find them most social media handles, all that kind of stuff. If
West
not, we'll
MD.
hand you off. But outside of that, thank you guys for what you're doing.
Thank you.
Yeah.
Awesome.
Appreciate
Yeah,
you.
No, thanks for having us on.
Keep
Super excited.
You're doing
great.
God's work, Amy.
Yeah.
I'm trying.
Doctor?
Doctor. We'll see you guys next time. Thanks for checking out this episode of the Best Hour of Their Day podcast. We appreciate you listening and choosing to have us help you in your passion for coaching and affiliate ownership. You can find more episodes just like this on all podcast platforms. If you're interested in learning more, you can reach out to us on any social media platforms, or you can visit www.besthouroftheirday.com to book a call. If you found this episode helpful for you, please share it so that we can help other coaches and affiliate owners to help build a bigger and stronger CrossFit community. Thanks for listening.